I went into orthopedics because I liked fixing things. And then I really enjoyed taking care of children, and I met someone named Dr. Howard Steele in Philadelphia. It was in my training. I spent a year with him, and he was just a Renaissance man and a great orthopedic surgeon, and I thought I wanted to have a life like that. I've never specialized and said, you know, like some doctors do, I'm only going to take care of knees or something, take care of the child from head to toe, any orthopedic need. But some of the areas that are the most satisfying are scoliosis, the spinal curvatures, fixing those. Those have been a lot of fun and very rewarding. And the other is doing things like limb lengthenings, and that's progressed over the years, and now there's self-lengthening nails and ways to do it that are just so much better than they have been previously. At Chore, I believe you get the best care that your child can possibly have in an environment where everybody is looking out after the child and wanting just the best for it. And those teams, I learned so much from the other providers and getting their perspectives on different issues. Whenever I take care of their problem, it's exactly the same thing that I would want for my child. And I think that's a really great question. I know sometimes it makes some providers uncomfortable when you say, what would you want for your child? But I think that's the question. And if you can't provide that kind of care, then I think you should do something else. It's very rewarding, I can tell you. And now I'm not only seeing, I've seen patients, and then I've seen them grow up, and then I've had them bring me their children, and even I have some that I'm seeing the child and maybe they have a familial problem that, and I've fixed the mother and maybe the grandparents also. So it's pretty interesting to follow people along over time. There's things you learn over time that just can't be gleaned from textbooks. I do a lot of work with nonprofits for the betterment of different things, and my two favorites are Special Olympics. I'm their board chairman, and I especially like the Polar Plunge that we do every year. And I do I run the scoliosis program for World Pediatric Project, and I travel to the Caribbean quite a lot to do surgery and to screen patients to get them ready for surgery.